Dr. Farah Shroff. I find her to be an amazing person anyway, whether she is a doctor of psychology, doctor of medicine, doctor of health. She's a fantastic person. And the other person that we've got who is a physician, Dr. Rajak Randhawa. Both of them are with me today, and we're going to be talking about Canada-India Maternal Association. Can you tell me something about yourself? First of all, welcome both of you.
Thank you so much, Sushma. So, I'm Farah Shroff, and I teach at UBC in the Faculty of Medicine in the Department of Family Practice and the School of Population and Public Health. And one of my passions for many, many years has been trying to alleviate maternal deaths around the world.
Right.
So I'm really, really happy to talk to you about that and to introduce my research assistant.
Hi, my name is Dr. Rajak Randhawa, and I completed my medical training from the U.S., and since then I've found a strong passion for global health and public health. And earlier this year I contacted Dr. Shroff, and she took me on board this project, and since then we've taken this project to new measures to reduce maternal and infant deaths in rural areas of India.
So does this mean that you both have to travel to India to look after this project, or are you collaborating with people in India and helping them out?
Both. We've got some amazing collaborators in India, about 5 physicians based. So we're doing the project in Odisha, in eastern India, and so we've got some of the most senior public health physicians, maternal health physicians in India, as well as some PhD researchers. And we've got a huge team in Canada. We've even got some collaborators in Hong Kong and Indonesia and around the world. So it's a really, truly international collaboration. But of course, to do really good work in India means that we have to listen to the women themselves. So we're planning a trip to India, those of us from Canada, about 5 or 6 of us are going from Canada, to go to the villages of Odisha and listen to what women are telling us about their lives, about their childbirth experiences, about their pregnancies, and to really hear what their hopes and dreams are. And we know generally what we want to do, but we want to have a very, very clear collaboration with women in villages before we start with doing, a huge amount of other work.
Dr. Shroff, this question is for both you and Dr. Randhawa. Why Odisha? I mean, the whole of India has got problems as far as maternal health is concerned. Why did Odisha, jump out at you?
Odisha actually has twice the rate of maternal death as other parts of India. It's a part of India where there's a great need. Can you imagine, Sushma, in a population of about 41 million people, that 7 women die every day in childbirth? Every day, Sushma, in childbirth. This is incredible. Think about how many friends you might have. Can you imagine that 7 of them might die every day?
Obviously, it is a staggering number. It is heart-wrenching that 7 women die, and that too in childbirth, and those children have got nobody to look after them.
This is one of the worst tragedies. You've just named it. When a mother dies, her existing children are left with nobody to take care of them, to love them, and to advocate them in the same way as their birth mother would. What we know is that the children who lived through this tragedy of losing their mother really, really suffer, because a mother is a child's best advocate. So the kids who survive don't do as well. They don't do as well in schooling. They don't do as well in their health. They don't do as well in their future. Losing your mother is really one of the worst tragedies that can happen to any of us.
Dr. Randhawa, you're a physician, and how did you get involved with this? Was there an incident that jumps out at you, and you can relate that to us?
Well, it's a multitude of reasons. First of all, as I stated, I had a passion for global health and public health. Therefore, I started doing research alongside Dr. Shroff. And it also has to do with my background. Like, both of my parents were born in villages in India under very basic circumstances, where a midwife and my grandmothers were present, and it was a very, very basic birth, and it was all done with the presence of the family. And although this was a healthy, normal birth, like the vast majority of the births that occur in India, unfortunately, every year in India, a million babies are dying per year before their first birthday. So this was a very alarming issue, and I wanted to get more involved in it and see what we could do collaboratively to reduce that number.
So you heard that, Sushma, 1 million babies every year die in India before they see their first birthday. 1 million!
So over here in Canada, who is helping you to go over there to look after or give the information that you have or to help them out?
Well, we are currently fundraising for the project, and we can happily give you...
Hi, मैं हूँ सिर, हाउस में ऑपरेशंस मैनेजर, और ये है सांडा परिवार की आवाजें। बड़े एक्साइटेड हैं ये, आप ही होंगे जब ऑप्टिक टीवी के लिए साइन अप करेंगे, क्योंकि अब ऑप्टिक टीवी पे नेटफ्लिक्स उपलब्ध है, यानी ढेर सारे एपिसोड बॉलीवुड और पंजाबी को। सांडा परिवार की आवाजें। बड़े एक्साइटेड हैं ये, आप ही होंगे जब ऑप्टिक टीवी के लिए साइन अप करेंगे, क्योंकि अब ऑप्टिक टीवी पे नेटफ्लिक्स उपलब्ध है, यानी ढेर सारे एपिसोड बॉलीवुड और पंजाबी ब्लॉकबस्टर्स आपके मनोरंजन के लिए। Switch to Optic TV and Internet now, and you'll also get a free 14 Samsung Smart TV when you sign up for 3 years. Call 310-6988 for details.
Website as well.
Oh, thank you.
Having said that, can you tell me what would happen from now on till the time you go to India, and when are you going there, and what would you be doing there, and how long are you going there for?
So we meet monthly. We have Skype meetings with our team in India, and we talk about the work that we're doing. So we've divided our work right now into 3 main foci. The first one is looking at training and how we can help in training whoever is at the childbirth location. So it could be a dai, a midwife, sometimes it's mother-in-law, sometimes it's mom, sometimes it's sister, whoever is there. So training, we feel, is one of our greatest strengths as Canadians, something that we have to offer that's got a lasting benefit. So that's one of the clusters of our work. Another cluster is looking at how to link traditional medicine providers who are already in the villages where we're working, and how to get them involved in saving babies and mothers' lives. This is something that we all know as Indians, that Ayurveda, Siddha, Unani, many systems of medicine have existed for thousands of years. But we haven't really tapped into working well with them, because for about the past 400 or 500 years, India, through colonization with England, got entrenched the allopathic system of medicine. And although about 75% of Indians use Ayurveda as their main system of medicine, a lot of these kinds of projects haven't integrated the traditional systems of medicine. And we're the perfect time, because the Indian government right now is really, really interested in Ayurveda, Siddha, Unani, and yoga. So this is a perfect moment for us to be trying to work with everybody who can try to make women and babies' lives better. So that's the second cluster. The third cluster is community development and sustainable livelihoods. And because we know that poverty and social inequality is really at the root of all of this, we know that the women who live in the greatest depths of poverty, the women who live with the greatest social discrimination, are at most risk of dying. We've got this project in the works for looking at how we can, alleviate poverty and try to get rid of these thousands of year-old structures. And we as Indians know these structures are very deep and hard to deal with. So we've committed as Canadians to at least 5 years to working on this project, because we know that things don't happen overnight.
Are there other organizations that are partners with you?
Yes, one of our physicians in India works with UNICEF. We've also got the Odisha government. We've got a school there called the KIT School of Public Health in Odisha that's linked with us. We're also going to be linking with the central government. So within India, we've got lots of organizations. Primarily from Canada, we're working out of UBC. So UBC Faculty of Medicine.
What can our listeners do for this project if there are some people who want to help? How can they help?
Right now, the biggest help that they could probably do is help us with fundraising. And Rajak is going to read out the link, and
So we also have a big development and seed funding, and we've received some donations by physicians and researchers in India and Canada. We also have the UBC Vice President Research Office. They have promised us some funds. And we've been taking private donations and donations to the ICBC, the UBC page, which the URL I can provide for you. It is www.support.ubc.ca/CIMIHC. And you can go to this webpage and kindly make your donation. And if you have any questions or comments, or if you just want to call and make a donation, you can phone 604-827-4111. And you can donate via telephone or the internet.
And you get a tax receipt.
Of course. That was my next question, and you answered it. I thank you both for taking time and talking to us. Next time we talk about this, probably you would have come back from Odisha, and we will ask you to tell us about your experiences.
Yes, that sounds wonderful, Sushma. We're planning the trip sometime in February.
Fantastic.
Yes, thank you for having us, Sushma. And one thing I'd like to add is that we will also be presenting on this